All right, so Glasgow coma scale or the GCS. Now, the GCS, or what you call the Glasgow coma scale, is a scale that is used to assess the mental state of somebody who has had a head injury or has hit the head on the ground or on a hard surface and then is exhibiting some kind of signs and symptoms. All right, so this is a scale that we use to assess. So quickly, let's dive into how this scale is being used. All right, so we have the behavior and then we have the response that person exhibits. So behavior of the person and then the response or the meaning, and then after that I'll show what these figures we have written over there means and then what we use it to calculate. So GCS is actually divided into three main things. We have the eye-opening response that patient can respond to or that patient can exhibit. We have the best verbal response. That is something that patient can exhibit. And also we have best motor response, also something that patient can exhibit. All right, so quickly let's look at the eye-opening response. So eye-opening response has to do with if you pinch a patient, hold the skin, and then you pinch, twist it, how patient is going to respond. Okay, so patient on the, let me start from the fourth one. Spontaneous, so patient can open the eye small and then look at you and close it. Okay, so patient can open the eye small, look at you and then close it. All right, now to speech, and you talk to patient. Patient is able to open the eye small and then look at you small. Patient can open the eye small and then look at you and then close it. All right, and then the second one is to pain. So patient hears pain. As I told you, hold it, twist it. Patient is able to open the eye small. Means patient can feel something. You understand? And if you do all these things, patient does not respond to anything. Means the patient has scored only one. So these are scores. The 1, 2, 3 are scores. All right. So patient has no response. It's 1. Patient has scored 1. If patient is able to respond to pain, open the eye, and then pain is applied to him or her, then patient has recorded 2. Patient is able to respond to, or open the eye small to look at you and you talk. Patient has 3. Then spontaneously, so 4. All right, so let's look at the best verbal response. All right, so when you talk to patients, patient is orientated to time, person, and then place. So patient is able to describe or tell you that, okay, and you ask patient, what is the time? Patient is able to tell you the time. Patient is able to tell you, okay, as soon as you are the one I'm talking to, or you are the lecturer who has been teaching me, or you are the doctor who is taking care of me. And patient is able to tell, okay, I'm in the hospital, or I'm at an accident scene. Means patient has scored 5. Patient is oriented to time, person, and then place. Now, if patient is confused but able to answer questions, so you ask patient questions, but then he's confused, so the answers doesn't really flow the way you want it. Okay, patient has scored 4. And then inappropriate words. Patient starts using words that you don't understand, or patient use words that is opposite to the questions you are asking him or her. It means that is inappropriate words. All right, so that means patient has scored 3. All right, so incomprehensible sounds. Patient is able to make some sounds like some sounds like that. Okay, so when those sounds come out, it means patient has scored 2. And if patient has no response to verbal, and you talk to patient, that's what I mean. Talk to patient, patient has no response, patient doesn't mind. It means patient has scored 1. All right, so we use it to calculate for something. Then the best motor response. So the best motor response is patient able to use some parts of the body. Okay, all right. So patient is able to obey commands. If you say patient raise your hand, patient is able to raise. Patient has scored 6. Patient raise your head. Patient is able to raise the head. It means patient has scored 6. He's always to obey command. And is able to move to localized pain. So when there is localized pain, like a general pain in the body, okay, or a pain that is centralized or is at a specific part of the body, okay, patient is able to move that part of the body. Let's say you pinch the hand, patient is able to move the hand or withdraw the hand later from you, your pain that you are infringing. Means patient has scored 5. All right, so flex to withdraw from pain. So patient is able to flex the hand. You are pinching the arm, is able to flex and then withdraw from the palm or from the pain that you're inflicting. Means patient has scored 4. Now abnormal flexing, the corticate position. So there's abnormal flexing. So the corticate posture is a posture that patient adopts. Patient lies down supine and then arms are clenched and then is folded in this way, like it's flexed inward. Okay, that's the decorticate posture, and then the arms are stiff and then lying down straight. All right, so means patient has scored 3. Now abnormal extension, that is decelerate posture. So the decelerate posture, patient has clenched the fist, alright, but then the arms are extended, like extend outward. I don't know if you get the point I'm making. So that's the decelerate posture. So the decelerate and decorticate posture are the images you are seeing on your screen now. So the first one is the decorticate posture. You see how patient is lying down and then arms in that posture. All right, so and the decelerate posture is the second one. You see how patient is lying down and then the arms are extended in that direction. Okay, so that's about those postures. And then patient has no response. That is 1. If patient has no response, it means 1. All right, so after you have taken patient through this test, okay, and patient is able to score 13 to, let's say, 15, patient has minor brain injury. Minor brain injury. Patient is able to score, let's say, from 9 to like 12. Patient has moderate brain injury. Then patient, anything below 9, patient has severe brain injury. So as a nurse, you need to know how to use this scale. Okay, so we use it to, as I said earlier, we use it to assess patient that has a head injury. All right, so we use it to assess the mental state of that particular patient, and it has 3 stages: the eye opening, verbal response, and then the best motor response. Patient is able to score. So how patient is able to score is that, let's say here patient is oriented to time, place, and person. By the time you come here, patient is able to respond to speech. So that is 5 plus 3, making what? 9. And then when you come here, patient is able to obey a command, plus 6, making what? 9 plus 6, making 15. So patient has minor brain injury, or patient is okay. And then when you take something like patient has inappropriate words over here, is able to respond to speech. So 3, making 6. And then patient is able to move to localized pain, plus 5. So patient is scoring like 11 there. Okay, so patient falls within this range, being it's moderate brain injury. Okay, so that's how we calculate it, and then it's very easy and very simple to use. All right, so if you're new to the channel, please subscribe to the channel and then hit bell underneath, so that anytime you upload a video, you'll be notified. And also please share the link with your friends and everyone, so that we can all learn together. All right, thank you very much. Once again, this is Concise Nursing. Goodbye.